Hey Elizabeth, what's your go-to move for low back pain?
Some exercises that I like to do for low back pain are stretches. So an easy one people can do is a hamstring stretch, just having one leg out in front. You want to feel the stretch here in the back of the leg. Try to touch your toes if you can, but most people can kind of just touch here along the shin. Hold it for 30 seconds to a minute, and then try and stretch the other leg. Another good stretch is a hip stretch, trying to cross your leg over. This one you want to feel here on the outside of the hip. Again, hold for about 30 seconds to a minute, and then try the other side. Another one that we can do is a bridge that you can do on the floor on your bed. So you can lay down on your back, have your knees bent, feet flat on the ground. Try to tighten up your stomach as you bring your hips up. If you can only bring it up a couple inches, it's okay, but really try to squeeze those hips. Hold it for a few seconds and then slowly back down. You should feel it a lot here in the glutes, but remember to keep the stomach tight. So I recommend doing about 10 to 20 reps. Do it a couple times a day if you can. Another one you can do if you have a yoga ball, sitting on it. This one's a pelvic tilt. So you want to tilt your pelvis forward, kind of like you're tucking your tail between your legs. But you should feel a nice stretch there in the low back. It's also going to help strengthen the core muscles. So you're just kind of rolling the ball forwards and backwards. Just nice and easy. Be careful not to roll off the ball. If you need to, you can grab on to something, have like a table or a chair close by. And then you can also go side to side. This will help stretch out the more sides of the low back. And do about 10 to 20 reps of each. So these are just a few exercises that'll help low back pain, which is pretty common for a lot of people, especially since most people sit at a desk a lot now. And if you have any pain with any of the exercises, please make sure that you stop and you can consult your doctor if there's any questions.